Hello, everyone, and a warm welcome. In this video presentation, I will be exploring essential multiple choice questions, MCQs, with brief explanations from Unit 2, in addition to the MCQs already uploaded in Anxiety Disorders, Phobia, Obsessive Compulsive Disorder, OCD, and Generalized Anxiety Disorder, GAD. Dear viewers, if you want to practice these MCQs, turn off the volume of your mobile phone during the first round. Then, in the second round, turn on the volume to check your answers. For MCQs on other topics, don't forget to subscribe to my YouTube channel. Let's attempt to solve some important MCQs one by one with a brief explanation. Question 1. What is a phobia? A. A type of medication for anxiety. B. An intense and irrational fear of a specific object or situation. C. A therapy technique for managing stress. D. A relaxation exercise for mental well-being. The correct answer to question 1 is option B. An intense and irrational fear of a specific object or situation. Explanation. A phobia is characterized by an intense and irrational fear of a specific object, situation, or activity. Question 2. Which of the following is a common feature of phobias? A. A well-founded and rational fear. B. Mild discomfort in certain situations. C. Avoidance behavior and panic attacks. D. Generalized anxiety across various situations. The correct answer to question 2 is option C. Avoidance behavior and panic attacks. Explanation. Individuals with phobias often exhibit avoidance behavior and may experience panic attacks when confronted with the feared object or situation. Question 3. What is the term for a fear of open spaces or public places? A. Agoraphobia. B. Social anxiety disorder. C. Acrophobia. D. Claustrophobia. The correct answer to question 3 is option A. Agoraphobia. Question 4. A fear of heights is known as A. Acrophobia. B. Claustrophobia. C. Arachnophobia. D. Hydrophobia. The correct answer to question 4 is option A. Acrophobia. Explanation. Acrophobia is the specific fear of heights. Question 5. What is the primary goal of exposure therapy in treating phobias? A. Suppressing emotions related to phobias. B. Avoiding the feared object or situation. C. Gradual and controlled exposure to the feared stimulus. D. Using medication to alleviate anxiety. The correct answer to question 5 is option C. Gradual and controlled exposure to the feared stimulus. Explanation. Exposure therapy involves gradual and controlled exposure to the feared object or situation to reduce anxiety over time. Question 6. Which neurotransmitter is often associated with anxiety and phobias? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Endorphin. The correct answer to question 6 is option B. Serotonin. Explanation. Serotonin is a neurotransmitter associated with mood regulation, and imbalances may contribute to anxiety and phobic disorders. Question 7. Social phobia, or social anxiety disorder, involves A. Fear of open spaces. B. Fear of social situations and judgment by others. C. Fear of heights. D. Fear of specific objects. The correct answer to question 7 is option B. Fear of social situations and judgment by others. Explanation. Social phobia, or social anxiety disorder, is characterized by an intense fear of social situations and concerns about judgment by others. Question 8. What is the term for the fear of flying? A. Aviophobia. B. Hydrophobia. C. Nyctophobia. D. Claustrophobia. The correct answer to question 8 is option A. Aviophobia. Explanation. Aviophobia is the specific fear of flying. Question 9. What characterizes obsessive-compulsive disorder, OCD? A. A fear of open spaces. B. Persistent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions. C. Excessive fear of social judgment. D. Panic attacks triggered by specific situations. The correct answer to question 9 is option B. Persistent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions. Explanation: OCD involves persistent, intrusive thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, performed to alleviate anxiety. Question 10. Which of the following is an example of an obsession in OCD? A. Repeatedly washing hands. B. Fear of germs or contamination. C. Checking and rechecking door locks. D. Counting steps while walking. The correct answer to question 10 is option B. Fear of germs or contamination. Explanation: fear of germs or contamination is an example of an obsession in OCD. Question 11. What is the primary goal of compulsions in OCD? A. Providing a sense of pleasure. B. Eliminating obsessive thoughts. C. Reducing anxiety or distress. D. Increasing self-esteem. The correct answer to question 11 is option C. Reducing anxiety or distress. Explanation: compulsions in OCD are performed to reduce the anxiety or distress associated with obsessive thoughts. Question 12. Which brain neurotransmitter is thought to play a role in the development of OCD? A. Serotonin. B. Dopamine. C. Acetylcholine. D. Endorphin. The correct answer to question 12 is option A. Serotonin. Explanation: serotonin is a neurotransmitter associated with mood regulation, and imbalances may contribute to OCD. Question 13. Which of the following is a common theme of obsessions in OCD? A. Fear of flying. B. Fear of being judged in social situations. C. Fear of heights. D. Fear of losing control and harming oneself or others. The correct answer to question 13 is option D. Fear of losing control and harming oneself or others. Explanation: a common theme in OCD is a fear of losing control and harming oneself or others. Question 14. Which age group is most commonly affected by the onset of OCD symptoms? A. Children and adolescents. B. Young adults. C. Middle-aged adults. D. Older adults. The correct answer to question 14 is option A. Children and adolescents. Explanation: OCD symptoms often begin in childhood or adolescence. Question 15. What characterizes generalized anxiety disorder, GAD? A. Intense fear of specific objects or situations. B. Persistent and excessive worry about various aspects of life. C. Panic attacks triggered by specific stimuli. D. Fear of social judgment. The correct answer to question 15 is option B. Persistent and excessive worry about various aspects of life. Explanation: GAD involves persistent and excessive worry about a wide range of life situations, often without a specific trigger. Question 16. Individuals with GAD often experience A. Flashbacks to traumatic events. B. Panic attacks with physical symptoms. C. Chronic muscle tension, restlessness, and fatigue. D. Aversion to social gatherings. The correct answer to question 16 is option C. Chronic muscle tension, restlessness, and fatigue. Explanation: common symptoms of GAD include chronic muscle tension, restlessness, and fatigue. Question 17. Catastrophic thinking, a common cognitive pattern in GAD, refers to an overwhelming fear of specific objects or situations. B. Believing the worst-case scenarios will inevitably occur. C. Experiencing panic attacks with no apparent trigger. D. Obsessive thoughts about cleanliness and contamination. The correct answer to question 17 is option B. Believing the worst-case scenarios will inevitably occur. Explanation: catastrophic thinking in GAD involves anticipating and fearing the worst-case scenarios. Question 18. Which of the following is a common physical symptom of GAD? A. Fear of social situations. B. Sudden onset of intense fear. C. Chronic headaches, muscle tension, or stomach aches. D. Compulsive behaviors and rituals. The correct answer to question 18 is option C. Chronic headaches, muscle tension, or stomach aches. Explanation: physical symptoms of GAD may include chronic headaches, muscle tension, and stomach aches. Question 19. What is the primary goal of cognitive behavioral therapy, CBT, in treating GAD? A. Medication management to reduce anxiety. B. Identifying and challenging maladaptive thought patterns. C. Exposure to feared situations to desensitize anxiety. D. Relaxation techniques to manage physical symptoms. The correct answer to question 19 is option B. Identifying and challenging maladaptive thought patterns. Explanation: CBT for GAD involves identifying and challenging maladaptive thought patterns to reduce excessive worry. Question 20. GAD often co-occurs with other mental health conditions such as A. Bipolar disorder, B. Schizophrenia, C. Depression, D. Obsessive-compulsive disorder, OCD. The correct answer to question 20 is option C. Depression. Explanation: GAD frequently coexists with depression and other mood disorders. Thank you everyone. Don't forget to subscribe to my YouTube channel Education and Teacher Education at Shoki Bilal.